Welcome back to Heroes on Our Island. I'm your host, Mike Stevens. Let's go to Setauket now to meet a man who's been fighting prostate cancer for 15 years. And along the way, as he fights, he's helping others as well. Wendy Gillette has his inspirational story.
Hi, Doctor.
Hey, Rich, how are you?
Richard Hammerblett of Levittown gets a clean bill of health during his recent doctor's visit.
Everything's going well. I have no complaints. Nothing's bothering me, which is good. Knock on wood.
It's a major improvement for Hammerblett, who's been battling prostate cancer since 1992, a devastating diagnosis.
I didn't hear a word the doctor said after that. Everything just went blank. I saw his lips moving, and I was just dazed.
Hammerblett underwent a number of treatments over the years which brought improvement, but the disease always resurfaced even after hormone therapy.
You have to, balance it, or compartmentize it, as I like to say, Otherwise, you go out of your mind, and, that you learn to survive.
A few years ago, Hammerblett came to North Shore Hematology Oncology Associates after the cancer had spread to his lower spine. He discussed all the possible treatment options with his doctor, Jeffrey Vasurka. Now there are more options than ever before.
This is a great year for prostate cancer, as we've seen multiple new medications come out for the treatment of these men.
Doctors say the new treatments have far fewer side effects compared to traditional chemotherapy. In May of last year, Hammerblett chose Provenge, the first vaccine approved by the Food and Drug Administration to treat cancer. The patient first goes to a blood bank where their immune cells are extracted. Those cells are taken to a facility. On the East Coast, it's in Atlanta, where they're incubated with prostate cancer proteins. 3 days later, the patient receives an infusion.
And this was basically tailored exactly for patients like Richard, who have been on hormone therapy, that are failing, and have signs of disease outside the prostate.
The Provenge uses your own immune system to attack the cancer because your immune system doesn't recognize it as a foreign object, so it just thinks that's natural. Where now it has a direction. Say, this is no good, we've got to get rid of this thing.
The treatment is not without controversy. It's expensive, some medical professionals have questioned its effectiveness, and one scientist has raised concerns about the studies used to get FDA approval. But Hammerblett has no doubt it works.
Last fall I went for an MRI and the cancer was gone. It's like a miracle, So, it's like my prayers were answered.
He's trying to spread the word about the new possible treatments that are available.
And hopefully it can help other men with prostate cancer.
Because there are so many men like Hammerblett. Hundreds of thousands are diagnosed with prostate cancer and tens of thousands die from the disease every year. It's estimated 1 in 6 men will be diagnosed with prostate cancer during their lifetime. Hammerblett urges men to get tested and keep track of their PSA levels, which stands for prostate-specific antigen. The levels often rise in men with prostate cancer.
Ask him what your numbers are. A lot of guys go to the doctor and says, what was your PSA number? I don't know. They should ask him and be aware of it so that they, in the future, can say, well, yeah, it did go up, because he may not be aware of it.
Hammerblett knows 3 people who died of the disease, but he's optimistic about his future.
There is hope, and I think I'm a perfect example of that. I thought there was no hope.
Hammerblett is extremely grateful to his doctor. There's a picture intended as a joke hanging on the wall at the practice, showing Dr. Vasurka's head on top of a picture of Superman. It's obviously just for fun, but it's not too far from the truth for patients like Hammerblett who feel the doctor helps save their lives.
I'm just thankful, for all the people and the people here, of course, that allowed me to take this procedure, and for the procedure itself.
Hammerblett still gets injections of a female hormone as well as minor chemotherapy, but Dr. Vasurka says his prognosis is excellent.
It's hard to know from any one patient how long they're going to live just by looking at them, but I would say Richard's going to be around for years.
And as he continues with his battle, Richard pledges to continue helping to raise awareness about the disease.